Okay, picture this. You've just walked out of the dental clinic.
Yeah.
Your teeth, they feel amazingly clean, like sparkling. Maybe a little sensitive, but, clean.
That fresh feeling, yeah.
Exactly. You're feeling pretty good. And then, bam, out of nowhere, this headache starts creeping in. And you're thinking, what on earth is that about?
It seems counterintuitive, right?
Totally. So welcome to the Deep Dive. We're the show that digs into the details and pulls out the insights you need.
And today we're tackling that very connection, the one between a routine teeth cleaning and sometimes a headache afterwards.
Yeah, it's surprising, but it happens. Our mission today is, not common.
Right. The vast majority of people, totally fine. But, a small number might feel some mild discomfort afterwards. That could be a headache, maybe some jaw tension.
Oh, okay.
The good news, though, is that these symptoms, they're usually pretty short-lived. We're talking maybe a few hours, and it's very rarely a sign of anything serious going on.
Okay, that is good to hear. Not usually serious, but still.
Yeah.
Why does it happen? That's the really interesting part for me.
Okay.
What's actually going on in our body?
Exactly. Let's get into the why. When you look at how our bodies react in that dental chair, there are a few distinct reasons that often kind of overlap.
Okay.
First one, and this is pretty common, just plain jaw strain, from keeping your mouth open for quite a while.
Right, because you have to stay open the whole time.
Precisely, especially if it's a really thorough clean, maybe there's a lot of tartar buildup that needs more scaling time. Holding that open position puts stress on your temporomandibular joint, your TMJ.
Yeah, jaw joint, yeah.
In fact, some data suggests that keeping your mouth open for that long can actually increase the pressure in the TMJ by up to 300%.
Whoa, 300%.
Seriously. It's significant. And that directly causes jaw aches, which then, easily turn into a tension headache.
Okay, wow. That makes a lot of sense. So it's a real physical strain, not just feeling uncomfortable. What else? Besides the jaw just being propped open.
Well, another big one is muscle tension. Think about it. A lot of us get a bit anxious at the dentist, right? Or even if you're not anxious, you might just be concentrating on holding still. And often, without even realizing it, you clench your jaw or tense up the muscles in your face and neck.
Guilty as charged. I think I do that.
It's super common. That sustained tension, especially in the big chewing muscles in your jaw and the ones in your temples, that's a classic trigger for a tension headache after the appointment is done. You only notice it once you relax.
Right, the delayed reaction. Okay, so physical strain, muscle tension. What about the actual experience? The sounds, the feelings?
Absolutely. That's the third point. Sensitivity to sounds or vibrations. It's often overlooked. But those dental tools.
Yeah, the high-pitched whirring.
Exactly. And things like ultrasonic scalers, they use high-frequency vibrations to break up plaque. And they make noise.
Mm-hmm.
For people who are just more sensitive to sounds or maybe prone to feeling a bit overloaded sensorially.
Like sensory overload?
Yeah, precisely. Those vibrations and noises can directly contribute to a headache after your appointment. Your body's just reacting to all that intense input.
Huh. Never thought of it that way.
Yeah.
A sensory headache from a cleaning. Okay, and you mentioned something more basic.
Yes, and it's so simple, but incredibly common. Just dehydration or skipping meals.
Right. Scheduling.
Exactly. People often squeeze appointments in, maybe during a lunch break, skipping lunch, or first thing in the morning, no breakfast yet.
Mm-hmm.
If you go into that appointment without enough water or without eating, well, your body might just respond with a dehydration headache. Simple lack of fuel and fluids. And here's a little extra bit. Dental anxiety can actually make this worse. It can cause dry mouth, and you might unconsciously drink less beforehand. So it can be a bit of a double hit sometimes.
Okay, this is all starting to connect. Jaw strain, tension, sensory stuff, dehydration. So knowing all this, what can you, the listener, actually do? How can you be proactive and try to avoid these headaches?
Right, that's the key question. And the good news is there are definitely strategies. It often comes down to a few key things you can control.
Okay, let's hear them.
First, the basics we just talked about. Hydration and nutrition. Make a real effort to drink plenty of water before and after your appointment, and try to have a light meal or snack beforehand.
Keep those energy levels stable.
Exactly. Stable blood sugar, good hydration. It sounds simple, but it makes a huge difference. Don't underestimate it.
So easy to forget in the rush, though. What about tackling that tension, the clenching?
Good point. If you know you tend to get tense or anxious, try some relaxation techniques. Even just consciously practicing deep breathing during the cleaning can really help reduce that muscle tension in your face and neck.
Just focusing on the breath.
Yeah. And here's a slightly unusual tip some people find useful. Bring a small, soft stress ball.
Ooh,
Yeah, just squeezing it gently can actually help redirect some of that nervous energy. It might even help you unconsciously relax your facial muscles, reducing that clenching.
interesting. Worth a try. Okay, what else?
This one's crucial. Talk to your dentist or hygienist. Communication is key.
Don't just suffer in silence.
Exactly. If you start feeling discomfort, especially in your jaw, let them know. A good team can often give you a quick break, maybe adjust your position, or find ways to make it easier.
Okay.
And building on that, don't be afraid to ask about using a bite block. It's just a small device that helps hold your mouth open and support your jaw. It can really prevent strain, especially if it's looking like a longer cleaning session.
Ah, I've seen those. Good tip.
And finally, something our sources really highlight is the importance of choosing a gentle and experienced dentist. You want someone who prioritizes your comfort.
Makes sense. The approach matters.
It really does.
Yeah.
For instance, some practices, like the teams at Smilepoint Dental, both in Holland Village and Mapletree Business City, Alexandra, really focus on this. They take extra care, especially if you mention you're nervous or if you've had headaches after cleanings before. They'll often adjust their technique. That kind of patient-centered care makes a real difference.
That's really valuable advice. Okay, so you've done your best, you've hydrated, maybe used a bite block, but sometimes a headache might still happen. How do you know when it's just, a cleaning headache versus something you should actually be worried about?
Yeah, that's an important distinction. How to tell typical discomfort from a potential red flag. So generally, these headaches related directly to the cleaning itself. They usually only last a few hours, maybe up to a day or two max.
Okay, relatively short-lived.
Right. But if a headache hangs around for more than, say, 24 hours, or if it gets worse instead of better, or, importantly, if it comes with other symptoms.
Like what kind of symptoms?
Things like a fever, feeling really dizzy, any swelling in your face or neck, maybe even a rash. If you experience any of those along with the headache, that's when you should definitely seek medical advice.
Got it. Because those aren't typical for just a cleaning reaction.
Exactly. They could signal something else entirely, maybe an infection or another issue that needs checking out, and likely unrelated to the cleaning itself.
Okay. And what about other minor things people feel after a cleaning? Like sensitive teeth?
Oh, yeah, definitely. Mild sensitivity, maybe your gums feel a bit tender or slightly sore. That's actually quite common and normal, especially if you had a fair bit of plaque buildup removed.
Because the gums were irritated.
Right. They just need a little time to heal and get used to being properly clean again. That usually settles down on its own within a few days, maybe a week or two. Nothing to worry about there.
Okay. And one more thing. What if someone has headaches? Maybe not right after a cleaning, but they suspect their teeth or jaw are involved somehow. How do they figure that out?
That's a great question because headaches can stem from dental issues beyond just the cleaning itself. The key thing to look for is pain or tenderness, specifically when you're using your jaw.
Like when eating.
Yeah, when opening or closing your mouth, chewing, maybe even just talking. If those actions trigger or worsen the head pain, that's a stronger sign it might be linked to an underlying dental problem.
Like what sort of problems?
Could be things like tooth decay, maybe a hidden infection, even a cracked tooth, or chronic jaw clenching or grinding. It's called bruxism. Those can definitely refer pain to your head.
So it pays to notice when the pain happens, not just that it happened.
Precisely. The context is really important for figuring out the source. That specific link to jaw movement or tooth pain is a clue. It's dental rather than, say, a tension headache from general stress.
Okay, that makes a lot of sense. So let's bring this all together then. The takeaway seems to be, yes, teeth cleaning can sometimes cause a headache, but it's definitely not the norm.
Right. Uncommon, usually mild.
And it's typically linked to pretty manageable things like that jaw strain from being open or muscle tension from feeling a bit stressed or even just forgetting to drink enough water beforehand.
Exactly. Minor, often preventable causes.
And the power really seems to be in your hands. Staying relaxed as best you can, hydrating well, talking openly with your dentist, maybe asking for that bite block. Those steps can make a huge difference.
Absolutely. It's about being prepared and communicative.
Which leads to a more comfortable and hopefully headache-free experience.
And what's really quite insightful about all this, I think, is how understanding these seemingly small body responses, like a headache after a cleaning, actually empowers us.
How so?
Well, it helps us take a more active, informed role in our own comfort, even during procedures we think of as totally routine. It shifts it from something passively happening to you to a part of your proactive self-care and well-being. understanding leads to better management.
That's a great way to look at it. Taking ownership of your comfort. I like that. And hey, if you listening have more questions about this, or perhaps you're looking for a really gentle, family-friendly dentist here in Singapore, you can always get in touch with the team at Smilepoint Dental Center. They have clinics in Holland Village and Mapletree Business City, Alexandra.
Yeah, they're genuinely focused on making sure you have a comfortable experience and, of course, keeping you smiling.